This is Core Conversations with Natalie Baggio.
Welcome back to Core Conversations. Today, I'm joined with Dr. Baghelai, one of our cardiothoracic surgeons here at Corewell Health in Southwest Michigan. Welcome to the podcast.
Thank you.
Thank you for being here with us today and sharing with our listeners all the great work that your program is doing. And I'm especially excited for you to highlight your new award that we just received on the 3 stars of our cardiothoracic program.
Glad to do that.
First, why don't you share with our listeners how long you've lived in the community and worked in the community and what you love about Southwest Michigan?
We've lived in Southwest Michigan for 22 years now. This is the only job I've ever had. So right after training, we moved to this community. There were many attractive features of the community, proximity to the lake, the small community feel, and most importantly, an excellent hospital system that needed us. So that's how we came here 22 years ago, and here we are.
Well, we're very lucky to have you and your wife helping serve in our community and our patients. So your position that you hold today and the work that you do can be very demanding and stressful and takes a lot of time and dedication. How do you personally unwind and get mentally prepared for the days ahead?
Exercise. That is really the meditative activity that really provides the strength, the mental relaxation to do what we do day in and day out.
Yeah, because cardiothoracic surgery is a very intense specialty. You must have a very strong mind and body and spirit to maintain that level of intensity. So tell us how you do that, what you love. Tell us about the program and how we're serving the community.
When I joined the program, we really set out on trying to establish world-class care. This was to focus on outcomes, to make sure that the quality of care is top-notch, make sure that new procedures, cutting-edge procedures are incorporated into the menu of services slowly but surely, so that we can really provide the entire menu of our specialty to the community.
What type of patients do you normally see in the office?
We see generally patients who have diagnosis related to the heart, to the blood vessels within the chest and elsewhere in the body. And also, let's not forget the lungs. Those are the other important organ in the chest cavity. So lung cancer and other non-cancer ailments that affect the lungs.
So having a program like this and someone like yourself that's ahead of this program is very unique for our geographical location and what we're doing. But not only are we delivering and having care available here to this level, you just received a national designation of high quality and outcomes excellence. Would you share that with our listeners today on what we received and why that makes a difference?
Glad to do that. In the specialty of cardiac surgery, there's a unique feature where the Society of Thoracic Surgeons, which is the highest governing body of the specialty in America, collects very granular information on every case that's done in America. The quality of a program is determined when, based on all the information related to the patient, there's a prediction of what the risk of various complications or not surviving is going to be. And then the actual outcome of that operation is really measured against that prediction. And if you significantly do better, meaning patients do better compared to what the prediction was, then you receive a star rating, which is publicly reported. So this is shared with everyone. And the majority of the programs in America are 2-star, and 10% of the programs end up receiving 3-star, which means their patients did significantly better than they would have been predicted to. So this really is a proud moment for our program to share that.
Yeah, and for the program, for our teams, and the community. I mean, when I think about, I was a CVU ICU nurse, so worked in this arena of how it took so many people to collaborate to even achieve 2 stars, let alone 3 stars, and how it really speaks to the dedication and the commitment to clinical excellence, because it revolves around the whole patient. And it's just so impressive that out of 10% of programs across the United States, we have that right here in Southwest Michigan.
100%. It's also super important to realize the size of the team that it takes to really achieve something like this. This is not one person's outcome. From the very beginning, the receptionist who welcomes the patient into the system, the office staff, nurses, surgical techs, anesthesiologists, intensive care specialists, rehabilitation specialists, and so on and so forth. There's probably 100 different individuals that take care of the patient, are involved in their care and recovery from day one until they're released back into the wild. So it's a very comprehensive and complex system.
Yeah. Well, thank you for leading that and helping make sure all those pieces that need to click together. But I think, as to your point, because it takes so many people, it speaks to the dedication of the team and the commitment to clinical excellence. So thank you for sharing that. I know you've been involved in some other advanced care in cardiac specifically. Is there anything you'd like to share with the community on what we're doing or how you're leading some other programs?
Besides the quote unquote bread and butter part of our specialty, in the last 5 years, we've brought the option of replacing heart valves without open heart surgery. And that's sort of really one of the proudest moments for our program. This is where you can implant a new heart valve without going through the surgical approach. These valves are cutting edge in technology, and they're delivered from the blood vessels, usually from the leg. And patients do quite well. A lot of them go home in a day or two. And this is an option that, especially for older patients who are higher risk for the traditional open heart surgery, it's a great option. It's a great life-saving option.
Yeah, and that's wonderful that we're bringing that type of technology here locally that can be more minimally invasive or less invasive to ensure that we're being able to take care of more patients in our community and keeping care local.
Yes.
Well, thank you very much for joining me today and sharing more about your program and all the great success of your program and how you're serving our community here in Southwest Michigan.
Thank you. You're welcome.
Thank you for joining us on Core Conversations. We'll see you next week.